actually, it's a journey from left to right. So we have had a lot of silos. Since 1990, Austria is creating digital health, but in form of silos. There are modern silos, old silos. Some silos are still existing, but we want to go to the right thing. So this is the key points of our digital e-health agenda. So our e-health infrastructure we have designed is designed for nationwide coverage. So all healthcare providers, and I mean really everyone, up to the dentists, are about to be connected to this infrastructure, and this is mandated by law. All e-health applications on top of this infrastructure are also designed for nationwide coverage. We have created an opt-out policy for our citizens to get highest coverage on the consumer side as well. The quality of documents was also a factor during this process. In parallel, we tried to harmonize our clinical contents so that we can make sure that the data stored in this e-health infrastructure is structured, provides semantic interoperability, and is, let's say, the step towards future applications where we have to extract data and have big data or AI or something like that. And we have to be ready for the European Union cross-border exchange called EHDSI. All our e-health applications are required by the policymaker to follow international standards profiled by IG if possible. So this is to maximize the cost effectiveness and sustainability of the undertaking. The standards we are using are HL7 CDA, DICOM, LOINC, ICD-10 for diagnosing, and OASIS for security standards. The timeline you see started very soon, 2004 with an e-health strategy. 2006, which is quite a while ago, we started creating the e-health infrastructure ELGA in the designing phase. 2012, we have had the laws enacted by the parliament, and since 2015, we are constantly rolling out this in our country. Today, we have almost all hospitals connected. The next are the GPs, and the pharmacists are kind of 30%. This is how the architecture looked like. It's very federated, as our country is, so the data resides at the point where it is created, except for some certain data like medication data and in future immunization data. The data exchange format is HL7 CDA. We have some central components, which is a master patient index, healthcare provider index, of course an access management system, and audit. And you see all of the stakeholders, the e-health stakeholders, are connected to each of these so-called ELGA areas to have a distributed system, but yet you can query all of them and assemble the data to one health record of each citizen. The current use cases are, and I would see it as a house. So the core is the basement. So we have identification of patient and access to demographic data, authentication of healthcare service providers and patients, and access control of logging. This is the basement. You need that for everything, otherwise you cannot do anything on top of it. And the other bullet here, the other block here, is, so to speak, the ground floor. It's the continuity of care applications, like sharing e-reports. At the moment, discharge summaries, imaging, laboratory, and nursing care situation reports. And the second application, e-medication, which is sharing medication data, so the patient's medication list, so to speak. And one additional application, which is already approved and currently in specification phase, is immunization. So collection of all vaccinations and immunizations for all citizens and all ages. As I said, these are no scope programs for children, mother-child, whatever. Everything is designed for being full coverage. Future use cases will be, of course, sharing more document types, sharing medical images, which is a big frequency in the data, in the continuity of care business, as well as e-referral and e-prescriptions. And the other applications like AI or something like that, big data, we see it as a kind of a first floor. You can only build a first floor if you have a proper ground floor, otherwise it would fly in the air. And this is on a national scale future. However, we have on provider scale or on province scale, we have some interesting activities on that to try that out. So this was very brief, the Austrian situation. If you have some further questions, just don't hesitate to contact me. Thank you.